I mentioned the NLRP3 inflammasome. It causes cell death by inducing something called pyroptosis, which is an inflammatory form of cell death. What triggers that was the real question. We do know that there are cell extrinsic factors, inflammatory proteins like S100A9 can do it, but there's also cell intrinsic pathways that are hijacked by these somatic gene mutations. Once you perturb the mitochondria, it'll cause a reaction of oxygen species to be released, and then it'll oxidize the DNA, and that will bind to the NLRP3 inflammasome and activate it. So when the cells die by pyroptosis, they lyse. So they liberate everything that was inside the cell. So as you might expect, there's going to be a lot more oxidized DNA in not only in the microenvironment, but it circulates. So just looking at it in the peripheral blood, in the plasma, oxidized DNA, mitochondrial DNA, is markedly elevated in MDS patients compared to normal age-matched controls, compared to patients with type 2 diabetes who have activation of the inflammasome that causes insulin resistance, and compared to most other hematologic malignancies. So it appears to be a good biomarker for us to look at and follow, probably in some of these new therapeutic trials going forward.